patient of mine who is 53, who back in the late 70s had a surgery for instability in his shoulder, where his shoulder was popping out repetitively. And since that time has developed progressive arthritis in his shoulder and progressive loss of function. When we saw him in the office, he had about 20-degree loss of external rotation, so he could only rotate his arm to about here, and he could elevate it to about here, and had tremendous amount of pain that was disabling for him throughout his normal life. We elected to go ahead and proceed with a total shoulder replacement, and he's done extremely well. And when considering the significant loss of motion, and we'll see the significant deformity that he had in his shoulder from his previous surgeries and wear over the last 30 years or so, have really had affected his shoulder, and we're really happy about how he's done. So at this time, we're 6 months out now, he's gotten about 30 to 40 degrees of external rotation in the neutral position and forward elevation to about 150 or almost 160, which is great. He's back playing golf again. He still lacks a little external rotation in the abductor position, but overall is doing very well. He can now get a golf club up into this position and hit the golf ball. He said he's driving about 20 yards further. So we're really pleased with him, and I think it's changed his life overall, and I think he'll agree with me.
Yeah, it's helped me on day-to-day sleeping, eating. Every day is a pleasure. There's no pain. Every day for the last 30 years, I grew up taking an Aleve in the morning with a pain of 7 out of 10, pain level here. 2 days after surgery, I was down to a 2. 2 weeks later, I'm a 0, and still a 0.
So he's doing really well, and we're really happy that everything's progressing as well as it is, and we're just going to try to get him to work hard on his handicap and get that down. So let's take a look at his x-rays here. So here's his preoperative x-ray of the AP x-ray of his shoulder. You can see he's got a significant amount of wear of his glenohumeral joint. The Y view is not particularly telling, but his axillary view here shows a significant amount of retroversion, 30 degrees of retroversion of his glenoid with significant amount of wear, and this is a challenge when you have this much retroversion. So here we see his postoperative x-rays, and you see that he's got a new humeral head in excellent position. His glenoid is well positioned, and you can really see the comparison between the two films. Now on his axillary view here, you can tell how he's now back in essentially neutral version, and has is a well-positioned prosthesis. He did have a significant amount of posterior laxity after his initial surgery. So intraoperatively, when we did his total shoulder, I did tighten up his posterior capsule to prevent him from sliding out the back, and we used a little button in the front to do that, and you can see that here, but he's done extremely well overall.